While I expect a spirited debate today, I would remind my colleagues that each senator is limited to 5 minutes, and we're going to try to keep that as tight as we can today. There's 27 of us, and we all probably are going to want to have our opportunity. At the end of the 5-minute time frame, I will gently tap the gavel if it appears that things are starting to lapse over, and encourage my colleagues and our witness to conclude their remarks at the conclusion of this time. President Trump and Secretary Kennedy have made a steadfast commitment to make America healthy again. Under this administration, HHS has placed patients at the center of the healthcare system, empowering them with the tools and information they need to create a healthier future. We know that chronic diseases such as heart disease and cancer and diabetes are some of the leading causes of death in America. Now the department has a renewed focus on tackling the root causes of chronic disease and promoting prevention first. I look forward to exploring ways that the federal government can further align payment incentives to support healthy living and fight chronic disease. The administration has also prioritized to end waste, fraud, and abuse in our federal health care programs, including through eligibility and enrollment verification. This critical work is not just about saving taxpayer dollars. It's about restoring trust and ensuring vital programs like Medicare and Medicaid are sustainable for generations to come. In July, the Centers for Medicare and Medicaid Services, CMS, announced that the agency identified 2.8 million Americans who were simultaneously enrolled in multiple Medicaid or Affordable Care Act exchange plans. Stopping this duplicate enrollment while working with states to ensure that individuals do not inappropriately lose coverage has the potential to save taxpayers $14 billion annually. CMS has also taken steps to provide states with additional immigration information to verify eligibility for federal health care programs. Preserving lifelines like Medicaid for those who are legally entitled under the law will ensure long-term sustainability. Congress has bolstered these efforts by passing the One Big Beautiful Bill. This bill enacts common sense reforms to reduce improper payments and brings needed personal accountability to the Medicaid program. These reforms will protect Medicaid and refocus the program on the most vulnerable patients, those whom the program was intended to serve. The OBBA also created the Rural Health Transformation Program, the single largest investment in rural health care in decades, to help stabilize and modernize the rural health delivery system throughout our country. These accomplishments reflect a vision for a healthcare system that is proactive, efficient, and patient-centered. While many of the issues discussed today may be partisan in nature, this committee has a deep history of bipartisan healthcare accomplishments. I remain committed to partnering with this administration and Ranking Member Wyden to enact policies that realign incentives in the prescription drug supply chain, expand access to telehealth, and ensure long-term stability in our physician payment system. Mr. Secretary, I look forward to hearing from you today about the administration's efforts to make America healthy again, and how we can continue to work together to achieve this shared goal. Thank you very much. Senator Wyden.
Thank you, Mr. Chairman. As the committee gathers today, the United States is in the midst of a health care calamity, the largest cuts to American health care in the history of our nation, and they are approaching like an avalanche. Last week, most of the senior leadership at the Centers for Disease Control and Prevention were fired, or they resigned after refusing to bow to Robert Kennedy's unceasing crusade against vaccines. I traveled across Oregon last month, and the message was the same from one end of the state to the other. Families are confused. They're scared about who to trust about their health care. Robert Kennedy and Donald Trump have done so much to feed that mistrust. This morning, my staff, in partnership with Senator Alsobrook's team, is releasing a report that shows the disaster of Robert Kennedy's 203 days in office, every single day there's been an action that endangers the health and wellness of American families. Robert Kennedy has elevated conspiracy theorists, crackpots, and grifters to make life or death decisions about the health care of the American people. Robert Kennedy's tenure is so far marked by 3 calling cards. One is chaos at federal health agencies, leaving families, doctors, and the entire nation confused and frightened. Corruption that benefits Robert Kennedy, Donald Trump, and their friends at the expense of taxpayers, and higher health costs for families. I ask unanimous consent, Mr. Chairman, to enter this report into the record.
Without objection.
Then there's chaos. It's been obvious from the start that Robert Kennedy's primary interest is to take vaccines away from Americans. During his confirmation process, he claimed to be pro-safety and pro-science, but his actions reveal a steadfast commitment to elevating junk science and fringe conspiracies. His agenda has not been about choices and information for families. Just last week, he threatened doctors that deviated from the new anti-science vaccine guidelines he released that make it harder for pregnant women and children to get the COVID vaccine. And then there's corruption. Robert Kennedy's bizarre statements and actions beg the question, why? Democrats on this committee answered that question months ago. Robert Kennedy can enrich himself and his allies. His family still stands to gain from class action lawsuits against vaccine makers. Now, Robert Kennedy fired every member, every single one of the group responsible for making vaccine recommendations to doctors across the country under the false pretense of conflicts of interest. Meanwhile, many of the new members of the panel are outright vaccine deniers who've appeared as paid witnesses in lawsuits against vaccine makers. Their conflicts of interest and ethics disclosures remain hidden under lock and key. On top of all this bedlam in American healthcare, just 2 months ago, Donald Trump signed into law the largest healthcare cuts in American history to pay for tax breaks for the wealthiest people and massive corporations in our country. Republicans know these cuts are going to hit communities like a wrecking ball. That's why they push the most severe cuts until after the election. That's why their members already introduced bills to roll back some of the cuts. Make no mistake, though, those cuts are being felt right now. We're seeing hospitals in Idaho cutting payments, hospitals and nursing homes. Providence Seaside Hospital in Oregon announced they're shutting down their labor and delivery unit. Every family is going to feel the burden of Trump care in America. Premiums are going to spike next year, especially for those who buy health insurance on their own, but the effects will be felt by those who get insurance also through an employer. Congress has an opportunity to extend the Affordable Care Act tax credits that lower the cost of premiums. Democrats are ready to pass an extension that stops a dramatic premium spike that would force many families to pay double what they do today. Instead of finding ways to help American families pay less for health care, Robert Kennedy is focused on his anti-vaccine mission, fueled by some kind of complex that the consequences be damned. Amid this litany of corruption and chaos, the one point I have to underline is Robert Kennedy puts children in harm's way every single day in America. To my Republican colleagues, I must ask, what line must Robert Kennedy cross before some of you will also join this alarm? This weekend, under the cover of darkness, Robert Kennedy attempted to disappear hundreds of children under his care at Office of Refugee Resettlement facilities. These children here without parents or family were rounded up in the middle of the night and put on planes to Guatemala. Lawyers on the ground described unthinkable scenes. Our staff, some who are here today, were party to this in the middle of the night. And one child said to their lawyer, "Why do they want to send me back? My mom is dead and my dad abuses me. Why do they want to hurt me?" This was an actual conversation. These actions were illegal. Documents show that many of these children were in the country to escape trafficking in their homeland. Mr. Kennedy calls himself a protector of children. Some kind of rich claiming from somebody who's flown on Jeffrey Epstein's private jet on multiple occasions. I don't think Robert Kennedy should be within 1 million miles of this job. Republicans on the committee had a chance to prevent the public health train wreck that Mr. Kennedy has engineered. Everyone voted for him. It is in the country's best interest that Robert Kennedy step down, and if he doesn't, Donald Trump should fire him before more people are hurt by his reckless disregard for science and the truth. I also would like to note Senator Cantwell has joined us in this effort. I hope, at the very least, Robert Kennedy has the decency to tell the truth this morning. Mr. Chairman, I have a procedural request I'd like to make at this time. It's a short one.
Proceed.
Thank you, Mr. Chairman. Mr. Chairman, it's unfortunate that I have to say this, but this is a witness who has lied to members of the Senate Finance Committee. In response to over 35 written questions, including from me, he said, and I quote, that he would do nothing as HHS Secretary that makes it difficult or discourages people from taking vaccines. That was clearly not true. His unprecedented unilateral actions to restrict access to COVID vaccines, that alone proves it. He tried to fire the Senate-approved CDC director after she chose the truth over what I consider his delusions. His prepared testimony even today includes the debunked lie that 500,000 children disappeared under the Biden administration's watch, a lie that the Trump administration is using as a pretext to hunt immigrant children and their families. So, my request, Mr. Chairman, and I think it is unfortunate that I have to do this, but given the unprecedented nature of the witness's behavior, I would ask now that the committee formally swear in Robert Kennedy as a witness.
Senator White and I will personally object and will reject your request. We will treat this witness as we treat all of the other administration witnesses who come before us. And let me just say again, as I said in my opening remarks, we will have some partisan disagreements today. We're having partisan disagreements right now, and I am having partisan disagreements with you on your characterization of the facts. The bottom line is we will let the Secretary make his own case in his opening statement.
I'll only say, Mr. Chairman, that this committee's unwillingness to swear this witness is basically a message that it is acceptable to lie to the Senate Finance Committee about hugely important questions like vaccines. I think it's a great mistake, and that's why I've made the request. I understand that you're not going to grant it, and we can move on.
We'll get to the bottom of your accusations, but at this point, I'm going to turn to our witness, the Secretary of Health and Human Services, Robert F. Kennedy, Jr. And Mr. Kennedy, Mr. Secretary, you may make your opening statement at this time.
Thank you, Chairman Crapo, and thank you, Ranking Member Wyden, for the invitation to appear before the committee today. Before I summarize what we've accomplished this year at HHS, I want to express my deepest condolence to the family of DeKalb County Police Officer David Rose, who gave his life to stop the gunfire attack on the CDC on August 8th. Officer Rose was a veteran. He was a husband and the father of 2 children. Officer Rose's widow, whom I visited, is expecting their 3rd child. I'd like Officer Rose's family to know that he remains in our prayers and that he will continue to be in our thoughts. Let me start with the big picture. Under President Trump's leadership, we at HHS are enacting a once-in-a-generation shift from a sick care system to a true healthcare system that tackles the root causes of chronic disease. Chronic diseases reach crisis proportions in our country. And finally, we have an administration that is taking action. The MAHA report assessment, which the White House released in May, was the first government analysis of the key drivers of childhood chronic disease: ultra-processed foods, chemical exposures, physical inactivity, and over-medicalization. This month, we will follow with the MAHA report strategy, the Trump administration's solution for addressing each cause. At HHS, we haven't just been writing reports. We have been the busiest, most proactive administration in HHS history. In just half a year, we've taken on food ties. baby formula contamination, the grass loophole, fluoride in our drinking water, gas station heroin, electronic cigarettes, drug prices, prior authorization, information blocking.
Those prior authorizations are marketed. It takes over 3 months to get a prior authorization. Senator Kennedy, do you know something?
The committee will come to order.
Those 3 authorizations, you're killing millions of people. Prior authorizations.
I apologize to you for that outburst, Secretary Kennedy. I would notify everyone else in the audience. Comments from the audience are inappropriate. If there are any further disruptions, the committee will recess until the police can restore order. Mr. Secretary, please proceed.
As I was saying, prior authorization, information blocking, and healthcare interoperability. We're ending gain-of-function research, child mutilation, and reducing animal testing. We are addressing cell phone use in schools, excessive screen time for youth, the lack of nutrition education in our medical schools, sickle cell anemia, hepatitis C, the East Palestine chemical spill, and many, many others. At FDA, we are now on track to approve more drugs this year than at any time in history. I'm also proud to say that HHS under President Trump is doing more with less. We have taken measures to fight waste, fraud, and abuse. Just by eliminating duplicative enrollments in CMS, we are saving taxpayers $14 billion a year. Meanwhile, we are expanding access for people who need it. We are ending racist diversity, equity, and inclusion practices and instead focusing on aiding low-income and vulnerable families, regardless of their race, which was the original intent of Title X. We're also pouring $1 billion into Head Start and the Administration for Children and Families. Compassion need not be the casualty of efficiency. I'd like to highlight some issues that have not gotten media attention. First, we are doing our part to fulfill the President's commitment to stop human trafficking, especially of children. We inherited a terrible humanitarian crisis from the previous administration with its open border policies, which allowed the appalling loss of 476,000 unaccompanied children. We have implemented policies now to ensure that that appalling tragedy can never happen again. We have knocked on 82,000 doors and located 22,000 of those children. I promise you that we will do more in the next 3 years. We are also addressing the disastrous health conditions in tribal communities on Native American reservations. I've met face-to-face with tribal leaders in dozens of communities and tribes in Alaska, Arizona, Idaho, New Mexico, and elsewhere. And I look forward to making HHS resources more available to those communities. One of the most significant initiatives under President Trump is the Rural Health Transformation Fund, part of the President's Big Beautiful Bill, which will provide the greatest investment of federal money into rural health care in history. Finally, I would like to address the recent shakeups at CDC. These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency with the central mission of protecting Americans from infectious disease. CDC failed that responsibility miserably during COVID, when its disastrous and nonsensical policies destroyed small businesses, violated civil liberties, closed our schools, caused generational damage in doing so, masked infants with no science, and heightened economic inequality. And yet all those oppressive and unscientific interventions failed to do anything about the disease itself. America is home to 4.2% of the world's population, yet we had nearly 20% of the COVID deaths. We literally did worse than any country in the world. And the people at CDC who oversaw that process, who put masks on our children, who closed our schools, are the people who will be leaving. And that's why we need bold, competent, and creative new leadership at CDC. People able and willing to chart a new course. As my father once said, progress is a nice word, but change is its motivator, and change has its enemies. That's why we need new blood at CDC. That's also why it's imperative that we remove officials with conflicts of interest and catastrophically bad judgment and political agendas. We need unbiased, politics-free, transparent, evidence-based science in the public interest. Those are the guiding principles behind the changes at the CDC, and that is what you can expect all across our agency for the next 3 years.
Thank you very much, Mr. Secretary. I'll begin with the questioning. And one of the first things I'd like to talk to you about is actually something that is under the auspices of CMS. And I spoke with Dr. Oz last night about this. I'm sure you're very familiar with it, though. And that is that in the One Big Beautiful Bill, there's a lot of attacks right now going on publicly about hospitals are in trouble. And the blame for that is placed on the bill, even though the bill hasn't even been implemented yet. The fact is, this committee held hearings on the troubles that rural hospitals are facing in the United States before the passage of the One Big Beautiful Bill. They've been facing difficulties in rural America for a number of years now. And the bill, the One Big Beautiful Bill, contained a rural health transformation program, which I would just like to ask you to comment on. This is that program which allocated $50 billion over the next 5 years to our rural community hospitals in the United States to help them deal with some of the financial crises that they are facing and transition to more stability. Could you comment on that program that is in the One Big Beautiful Bill?
Yeah, Senator, one of President Trump's campaign promises and one of the principal preoccupations, not only of Republican senators when I did my confirmation hearing, but also almost equally among Democratic senators, with the crisis in rural health. We've had 120 rural hospitals close over the past 10 years. These institutions are not just delivering health access to rural Americans, but they are economic centers, they are cultural centers for those communities. They are often the largest employer. They are the highest paying jobs, and they are the centerpiece for those communities. So when they die, the communities collapse. And President Trump promised to do something about that, and he has delivered on that promise. Right now, we spend about 6% of Medicaid funding is sent to rural hospitals, a very, very tiny slice, and that's one of the reasons they're in trouble. President Trump has now allocated through the One Big Beautiful Bill $50 billion, so $10 billion a year over the next 5 years. What we give to rural hospitals, that 6% represents $19 billion a year. So we're increasing that by $10 billion. So we're infusing more than 50% increase in the amount of money that is going to rural communities over the next 5 years. There's never been anything like that in history. It is the biggest investment, and it should stem this hemorrhage.
Well, thank you. I appreciate your giving clarity to that, because it is frustrating to see these continuous allegations that the difficulties that our rural hospitals are facing all were created in the last few months when we passed a bill, when we've been holding hearings in this committee about these problems. And in the bill that we passed, we gave a $50 billion boost to, as you indicated, increase by 50% the federal support for our community rural hospitals in the United States. And I think that the hospital owners understand that. They recognize this support. In fact, they are coming they're coming together very carefully with Dr. Oz to work on the rollout of this program so that we can see this boost and this support that is coming. Just another one of the disagreements we have about what really was in the One Big Beautiful Bill. So I appreciate you commenting on that. In the last minute and 10 seconds that I have with you, could you just quickly talk once again about the broad issue of making America healthy again in terms of our aim to change the healthcare system's focus from a reactive symptom management model to one that focuses on lifestyle choices and the root causes of chronic disease?
Yeah, Senator, you know, this morning I got the latest numbers from CDC that 76.4% of Americans now have a chronic disease. This is stunning. When my uncle was president, it was 11%. In 1950, it was 3%. Today, it's 76.4%. 8 out of 10 of our kids cannot qualify for military service. This is a national security issue. When my uncle was president, we spent zero on chronic disease. Today, we spend $1.3 trillion. It's the biggest cause, it's increasing. And all of the arguments that Republicans and Democrats have about single payer, Obamacare, or the various ways to allocate the health dollars, they're all like rearranging deck chairs on the Titanic. If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job. This was their job to keep us healthy.
Thank you,
and I need to fire some of those people to make sure this doesn't happen again.
Thank you, Mr. Secretary. I have to cut myself off to make sure I keep to this time frame too. Senator White.
Thank you very much, Mr. Chairman. I've made it clear. I think that Secretary Kennedy is dead set on making it harder for children to get vaccines and that kids are going to die because of it. And Mr. Chairman, I'd like to put in the record today an op-ed written by Susan Monarez, who was fired by Mr. Kennedy.
Without objection.
So what we know, and Dr. Monarez, you know, was approved by Republicans. She wrote an op-ed today in the Wall Street Journal, which I've just put in the record, and I quote her. She said, "I was told to pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric." So, this is not some liberal philosopher or something. This is the CDC director who tells the Wall Street Journal, which is not exactly interested in progressive, you know, theories and the like, that she was told to pre-approve the recommendations of a vaccine advisory panel filled with people who've publicly expressed anti-vaccine rhetoric. So, my first question, Mr. Secretary, is, did you, in fact, do what Director Monarez said you did, which is tell her to just go along with vaccine recommendations, even if she didn't think such recommendations aligned with scientific evidence?
No, I did not.
That's a yes or no. So you have an opportunity to call her a liar if you say that you didn't do it, but I'd like to see you respond to this.
No, I did not say that to her. And I never had a private meeting with her. So there are witnesses to every meeting that we have, and all of those witnesses will say, I never said that.
So she's lying today to the American people in the Wall Street Journal?
Yes, sir.
Okay. Let's talk now about what's coming up, because I've made it clear what I've thought about the 203 days with my colleague, Senator Also Brooks. In 2 weeks, CDC's Advisory Committee on Immunization Practices will meet to make decisions about critical vaccines that protect us against hepatitis B, measles, and more. The committee's got a profound impact on vaccine access, but these aren't ordinary meetings. You've stacked the deck to ensure the panel bends to your views. In June, you fired all 17 committee members who are respected scientists and doctors. You replaced them with non-experts, vaccine skeptics, and conspiracy theorists. As a result, this critical advisory panel has lost scientific credibility. After years, colleagues, we spend so much time not looking at this as Democrats and Republicans, but as good science and scientific credibility. And now the American Academy of Pediatrics has warned that the committee is being politicized at the expense of children's health. American Academy of Pediatrics, you think they're lying too?
I think the American Academy of Pediatrics is gravely conflicted. They get Their biggest contributors are the 4 largest vaccine makers. They run a journal, Pediatrics, which they make a lot of money on, that is completely dependent on pharmaceutical companies. So I wouldn't put a big stake in what they say that benefits pharmaceutical interests. Senator, I didn't politicize ASIP, I depoliticize it. The Congress has been investigating ASIP.
All over the country, Mr. Secretary, scientists and doctors are saying otherwise. They're all wrong too. They're all lying, according to you.
The scientists and doctors are supporting me all over the country. There is division on opinion.
I don't get letters from thousands of people who are not political saying that this set of changes is going to damage American healthcare, and particularly these healthcare agencies, for decades to come. I don't get any letters from people saying, hey, this is going to make a big difference forever.
Yeah, maybe you're listening to a selective group of people.
You get me.
Yeah, and I will.
Fine.
I will tell you what, Senator. I will put my mailbag against your mailbag any day of the week.
30 seconds. Dangerous respiratory viruses like RSV are on the agenda for the next advisory meeting. Countless parents have been awakened in the dead of night by a wheezing kid gasping for air, forced to rush their little one to the ER. There's no worse heart-wrenching fear. The RSV vaccine offers these kids protection against the worst effects of the virus. But now it looks like you're on a crusade to make infants and babies more vulnerable to the terrible illness. That's what we're doing with the COVID changes.
And please make your answer brief, Mr. Secretary.
I've said that.
The position is indefensible. I think it's possible.
Congress has been investigating that committee for 23 years because it is pervaded with conflicts of interest. What we did is we got rid of the conflicts of interest and we depoliticized it and put great scientists on it from a very diverse group.
Let me close with
very pro-vaccine.
Let me close with this, because like Senator Crapo, I'm a few seconds over. I don't think, Mr. Secretary, this is about you and me. This is about kids being pushed in harm's way by reckless and repeated decisions to get scientists and doctors out of the way and allow conspiracy theories to dictate this country's health policy. I don't see any evidence that you have any regrets about anything you've done or plans to change it. And my last comment is, I hope that you will tell the American people how many preventable child deaths are an acceptable sacrifice for enacting an agenda that I think is fundamentally cruel and defies common sense. Thank you, Mr. Chairman.
Do I got a reply? Or, Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%. And you said nothing. You never asked the question why it's happening. Why is this happening? Today, for the first time in 20 years, we've learned that infant mortality has increased in our country. It's not because I came in here. It's because of what happened during the Biden administration that we're going to end.
I'm going to let Senator Wyden respond briefly to that, and then we're not going to go over like we just did.
Defend this committee on a bipartisan basis. Colleagues, my cabinet secretary says that we have no interest in chronic care. Mr. Secretary,
Mr. Chairman, could we have regular order, please?
We are in the process of turning around the Medicare program with the chronic care bill that Chairman Hatch, when he was chairman, and this committee put together on a bipartisan basis.
All right, we're going to proceed. And I just want the rest of the members to know, I gave Senator Wyden as ranking member some leeway there, but we're going to stick to the 5 minutes. Senator Grassley.
First of all, thank you. I have asked HH secretaries in the past to fully utilize the Rural Community Hospital Demonstration Program under Medicare. The program has been underutilized. In May, the CMS filled the open slots. Thanks to your agency's work, there's been 10 more rural hospitals in the program. It's important that the federal government uses every tool possible to help rural hospitals, and thank you for making that possible. Now to my questions. Back in January, during your confirmation hearing, you told me that you agreed to leave farming regulations to the Department of Agriculture and EPA. Do you think that any comments you have made since your confirmation on topics dealing with agriculture are consistent with what you said in January, that USDA and EPA ought to be regulating farming, and that the Department of Health and Human Services should not seek to regulate farms, the tools they use, or the markets that they sell into.
Yes, Senator, we are working very, very closely with Brooke Rollins and with the agricultural community. We've met with over 140 farm interests over the past 3 months to incorporate them to make sure that the MAHA agenda is consistent with their agenda. We are producing the best food in America, that we're protecting our soils and our soil microbiome, and that we're protecting all kinds of farmers, including those who want to transition to regenerative agriculture. We're consulting every stakeholder in the farm community in everything that we do.
I just raised the question because farmers in my state have been concerned about some of the things you're saying.
Senator, I can't hear you.
I'm sorry. Some of the farmers in my state have been raising questions about some of the things that they think you said, whether it was out of context or not. I just thought I'd raise this question so that you would keep by what you told us back in January at your confirmation hearing. Now, Senator Durbin and I have a bipartisan bill that requires price disclosures on TV ads. Price transparency is important in drug advertisement. I know that President Trump, Vice President Vance, and you are all supportive of this effort. When can I expect action from this administration on requiring drug companies to publish the price of drugs in their TV ads? And just in case you would tell me that you don't think you have that authority, can you help Senator Durbin and I on our bill so that we can ensure that you have legal authority to require price disclosure?
Senator, I think it would be good for us to talk about this offline. We are working on this in our agency, and I'm happy to give you the details of what we're doing.
Okay. I got a question here on transplant. Senator Kennedy and I have been working Senator Wyden and I have been working on this. For nearly 2 decades, I've engaged in a bipartisan oversight of the organ transplant system. RESA has developed a tool to combat transplant line skipping. I hope that you can take steps to make sure that these steps are being taken by HHS and ERISA to curb transplant line skipping. On July the 2nd, Senator Wyden and I wrote you a letter highlighting cases of OPOs in Mississippi and Kentucky. In each of these cases, OPO allegedly tried to harvest organs from patients still showing signs of life. I expect you to take steps through these organizations to ensure that this doesn't happen again.
We have mounted a major investigation of misconduct, of illegal behavior, of organ harvesting, of living people, of line skipping, of favoritism, of all kinds of scandalous behavior inside the organ procurement organizations. We have already ended the contract, terminated the contract with the sole source provider. We are reorganizing the entire industry so that this can never happen again. I'm happy to go into the details with you if I had more time.
Thank you. Senator Cornyn.
Mr. Secretary, the United States spends approximately 18% of our GDP on health care, and yet by most accounts, we rank roughly 10th in the world in terms of a health care outcome. Our Democratic colleagues seem to think the more money you spend, you're necessarily going to improve those outcomes. But at the same time, we have the two major drivers of our national debt, Social Security and Medicare, while we spend more money on interest on the national debt than we do on defense of the nation, which is an unsustainable trajectory. What is it that you're doing to address the effectiveness and the outcomes of our healthcare expenditures as opposed to just throwing more money at the problem?
Yeah, I mean, throwing money at the problem does not work. We spend 2 to 3 times per capita what European nations spend on healthcare, and we have the worst health outcomes. We're 79th in health outcomes globally. Over the past 20 years, we've lost, or 30 years, we've lost 6 years to Europe in terms of longevity. So our lifespan was even with Europe's, now it's 6 years behind. As I remarked to Chairman Wyden this morning, or Minority Leader Biden, today we got new data that showed that infant mortality has increased in this country in 2024 for the first time in 20 years. Diabetes has gone up 98% in 20 years. Nobody's doing anything about it. CDC's job was to make sure that this didn't happen. And what we're going to do is reorganize CDC, but also we've already righted the ship at NIH, at FDA, at CMS. And we are going to end the chronic disease epidemic. We are devoting thousands of studies. We're going to devote to identifying the causes, and we're eliminating them. And we're already starting. We're not waiting for everything to come in. We are starting now. We're doing this with food dyes, with grass stands, with dietary guidelines. We're going to get better food and better health to the American public because it's chronic disease that is bankrupting us and destroying our national security.
It seems to me one of the biggest problems that we have in America today is the trustworthiness of the information that we actually receive from the news media and from any other source. And obviously the easiest thing for our Democratic colleagues to do is to scare people because that is a powerful emotion, no matter what the facts may be. Do you believe COVID-19 was politicized?
Yeah, the whole process was politicized. Senator, I mean, we were lied to about everything. We were lied to about natural immunity. We were lied to about, we were told again and again the vaccines would prevent transmission, they prevent infection. It wasn't true. They knew it from the start it wasn't true because that's what the animal studies and the clinical trials showed. We were told that there was science behind cloth masks. The CDC allowed the teachers union to write the order closing our schools, which hurt working people all over the country, and then pretend it was science-based. All of these issues, and then I can show you, like, for example, Chairman Wyden was talking about me politicizing ACIP, but during COVID, probably the most famous scientist on ACIP was Martin Kulldorff from Harvard, the great world-renowned epidemiologist and vaccinologist. And he criticized the COVID booster mandates. They ejected him from COVID because he wasn't in the orthodoxy. The two biggest health officials at FDA during COVID, Dr. Gruber and Dr. Krause, criticized the Biden mandates, vaccine mandate. President Biden said in August, I would never take that vaccine, the Trump vaccine. And he came in, he mandated it, and then he fired the two top health officials at FDA who said, hey, this thing has not been properly tested. So the whole process was politicized, and even today.
So let me, in 15 seconds, so I think you answered yes. It was politicized. And I have concerns that when you look at some of the conflicts of interest in peer-reviewed articles in professional journals, and when you point out that even some of the physician associations are conflicted because of the money they get from the pharmaceutical industry, Are you committed to trying to make sure that we use the best science and separate and eliminate politics as much as possible?
That is what my job is. That's what my mission is. Eliminate the politics from science.
Senator Bennett.
Mr. Secretary, in June, you fired every member. Mr. Secretary, Mr. Secretary, may I have my time back, Mr. Chairman? Thank you. Mr. Secretary, thank you for your attention. In June, you fired every member of the well-qualified panel that was charged with recommending vaccines to the CDC. No one in your job has ever fired every committee member all at once. That month, you told the American people that you were, quote, going to bring great people onto the ACIP panel, not anti-vaxxers. Are you aware that one of the people you put on the panel, Dr. Robert Malone, claimed that the commonly used mRNA vaccine, quote, causes a form of AIDS and can damage children's, quote, brains, their heart, their immune system, and their ability to have children in the future? Yes or no, Mr. Kennedy?
And Dr. Malone is one of the inventors.
Yes or no? Yes or no? Were you aware that he had that view when you appointed him to this panel?
Dr. Malone is one of the inventors. As I said, Dr. Malone is one of the inventors of the mRNA vaccine. So he knows a lot more about it than I do.
Mr. Chairman, that statement is not true that Dr. Malone made, just as it wasn't true when you wrote that, quote, African AIDS is entirely different from Western AIDS. Are you aware that another one of these new members, Dr. Levy, wrote that, quote, evidence is mounting and indisputable that mRNA vaccines cause serious harm, including death, especially among young people? Yes or no? Are you aware that he said that?
I wasn't aware he said it, but I think I agree with it.
You agree with it? It's not true. It wasn't true when he said it, and it's not true when you said it. Secretary Kennedy, later this month, your new panel will meet to consider changing vaccine recommendations for American children. In addition to the COVID-19 vaccines, they are set to review recommendations for the hepatitis B vaccine, for measles, for mumps, for rubella and varicella vaccine, and the RSV vaccine. These are common back-to-school vaccinations for children all over the industrialized world. If you change that, you owe parents in Colorado and across the country the benefit of some transparency, I think. If your panel recommends changing the vaccine schedule for children, do you anticipate that fewer children will receive these common vaccinations, yes or no?
What I would say, Senator,
the obvious answer is yes. Should parents and schools of Colorado be prepared for more measles outbreaks as a result of that, Mr. Secretary?
Senator,
how about more mumps outbreaks?
I do not anticipate a change in the MMR vaccine. ACIP is an independent panel, so.
Well, it's a panel you just put those folks on. Far from what you said, they're people with ideas that are completely outside the mainstream.
You mean out of the pharmaceutical paradigm?
Let me just say, Mr. Secretary, all these vaccines that we're talking about today are free and accessible to parents today in America who have the freedom to be able to make that choice for their children. Will that be true after your handpicked panel makes their judgments about these vaccines?
I think that parents should be free to...
I know you said that before. I do too.
To make their own choices.
So will they be just as free after these?
I assume they will be.
I will hold you to that, Secretary Kennedy. Because this is not a podcast. It is the American people's health that's on the line here. This is the last thing, by the way, our parents need when their kids are going back to school, is to have the kind of confusion and expense and scarcity that you're creating as a result of your ideology. I think it's critical for you to share the evidence that this panel will rely on. Will you give the American people 6 months or 6 weeks in advance the record that they're going to rely on to make these decisions? Will you make it transparent for the American people?
All the evidence is transparent.
Will you make it in advance transparent for the American people so they can comment on it?
All the evidence is transparent for the first time in history, and you were never there complaining when the pharmaceutical companies were picking those people and then running their products through with no safety testing.
You can characterize it any way you want. I quoted them today. What I said was accurate. What you said were lies. You described people
Senator,
moving the Titanic.
Are you saying that a mRNA vaccine has never been associated with myocarditis or pericarditis in teenagers?
I am simply.
Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel, after firing the entire.
You're evading the question.
No, I'm asking the questions here,
You're
Mr. Kennedy.
evading that question.
I'm asking the questions,
I
Mr.
asked you a
Kennedy.
question.
I'm asking the questions for Mr. Kennedy on behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time in the history of that agency.
Senator Cassidy.
Thank you. I'll try and restore a little calm here. And I'm approaching this as a doctor, not as a senator. I am concerned about children's health, seniors' health, all of our health. And I applaud you for joining the president in a call for radical transparency. Thank you for that. I said yesterday, I believe it, that President Trump deserves a Nobel Prize for Operation Warp Speed. If he had been President Obama, he would have gotten it. But because of Operation Warp Speed, forcing the federal government to come to a vaccine development within 10 months when others said it couldn't be done, we saved millions of lives globally, trillions of dollars, we reopened economies, an incredible accomplishment. Mr. Secretary, do you agree with me that the president deserves a Nobel Prize for Operation Warp Speed?
Yeah, absolutely, Senator. That was phenomenal.
Let me ask you, but you just told Senator Bennett that the COVID vaccine killed more people than COVID.
Wait,
that was a statement.
I did not say that.
Okay, then let me ask, because you also...
Senator, I just want to make clear, I did not say that.
We'll check the record. That's a question of fact. You also said that you were also, as lead attorney for the Children's Health Defense, you engaged in multiple lawsuits attempting to restrict access to the COVID vaccine. Again, it surprises me that you think so highly of Operation Warp Speed when, as an attorney, you attempted to restrict access. Well, let me ask.
I'm happy to explain why.
I have 3 minutes and 30 seconds left. Right. It also surprises me because you've canceled, or HHS did, but apparently under your direction, $500 million in contracts using the mRNA vaccine platform that was critical to Operation Warp Speed. Again, an accomplishment that I think President Trump should get a Nobel Prize for. You canceled $500 million in contracts. Now, I grew up in a middle-class family, so $500 million seems, this is canceled, it seems like an incredible waste of money, but it also seems like a commentary upon what the president was attempting, what the president did in Operation Warp Speed, which is to create a platform by which to create vaccines. So this just seems inconsistent that you would agree with me the president deserves a tremendous amount of credit for this.
Is this a question, Senator Cassidy, or is this the speech that you don't want me to answer? Because I want to answer that question.
Please.
If it's a question.
But be tight, please.
First of all, the reason that Operation Warp Speed was genius is it did something nobody had ever been done. I don't think any president, but President Trump could do it. It got the vaccine to market that was perfectly matched to the virus at that time when it was badly needed, because there was low natural immunity and there were people getting very badly injured by COVID. But it was also brought in therapeutics like hydroxychloroquine and ivermectin and protocols for treatments. And there were no mandates. And then
okay, I have another question, so please.
That's when I began litigating against President Biden's mandates. now.
I'm sorry, let me go on because
In terms
you've
of
covered
me
the mandates
canceling those
before.
contracts,
I have limited time, Mr. Secretary, I'm sorry. You've called for, and rightly so, that we should restrict participation in agencies for those with conflict of interest. I would like to submit for the record a evaluation of the conflict of interest of those who are on the ACIP and the Vaccines and Related Biologic Products Advisory Board. It was not 97% as alleged, rather it was 6.9%, and it was 1.2%, I think, for the other panel.
Without objection.
Now, I am concerned, though, because many of those whom you have nominated for the ACIP board.
Senator,
Excuse me,
you have the facts wrong in there.
excuse me, can I have my time back?
Yes.
Yeah. What I am concerned about is that many of those whom you've nominated for ACIP have received revenue as serving as expert witnesses for plaintiffs' attorneys suing vaccine makers. Now, one of my colleagues in another setting alleged that you seem more interested in settlements than science. If we put people who are paid witnesses for people suing vaccines, that actually seems like a conflict of interest. Real quickly, do you agree with that?
No, I don't. It may be a bias, and that bias, if disclosed, is okay. But it's not a financial. It's not a financial conflict. It's not a financial conflict of interest.
Let me finish up. You also told Senator Wyden at the outset that you didn't want to take vaccines away from people. And as I conclude, I would like to say this. Because of the conflicting recommendations made about COVID. This is from Eric Erickson, good conservative out of Atlanta, Georgia, occasionally gives me hell. My wife has stage 4 lung cancer. She is one of the people the COVID vaccine actually helps. Thanks to the current mess at HHS, CVS is unable to get her vaccine. Secondly, an email from a physician friend of mine. Hey, Bill, I'm not even sure what I'm asking you, but we're all confused and concerned about who can get the COVID vaccine. We are having our attorney try and render an opinion, but there's no firm guidance and concern about liability if vaccines are given to a patient who requests it, but not on the current CDC list. Pharmacists are requiring a prescription now even for patients over 65, creating a huge headache. I submit these for the record.
Without objection.
I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
Thank you, Mr. Chairman. Following up on that same line as Senator Cassidy, because that's exactly, I represent one of the most science-based states in the country. That is percentage of scientists per capita. And at your confirmation hearing, we asked about this, whether you would follow science. You've made a statement here today in your testimony that you would follow science, and yet you're not following science, and that's what Senator Cassidy's question was. It's a simple yes or no answer. Do you think the president deserves to get a prize for warp speed in the mRNA technology that saved so many lives? And you won't answer that question.
I answered it.
No, you're saying that there are problems with what was interpreted. You could say yes. You should say yes.
I said the president also deserves a Nobel Prize, but our mRNA vaccines that we're working on, the ones that we canceled, which are for upper respiratory infections alone,
you canceled $500 million of research because the mRNA technology is about continuing the research to be ready for the next flu, influenza, the next pandemic, and you have to do the research.
I'm happy to have a detailed discussion with you about it. You're so wrong on your facts.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines. The history on vaccines is very clear. This is the 20th century. That's how many people had vaccines and had illnesses. This is the 21st century. This is the decrease, 99% down to 100%. This is what was delivered with vaccines, and you don't want to support that. You don't want to support that evidence. So yes, the governors of the West, Washington, Oregon, and California, will take up the efficacy of science. Yes, the University of Washington will deliver the science that America will depend on, because you don't want to depend on it. And his own Surgeon General of the Trump administration said over 2 million lives were saved because of the mRNA technology, and you don't want to continue that. You don't want to continue that technology. So what country is going to now take up that technology lead? What country is going to do that? Leaving us more vulnerable to some other country, keeping the advantage on having the best technology. So I'm telling you, I represent a state that's about technology. I have two other quick questions for you.
These questions or statements? Because I can answer that question if it's actually a question.
Do you believe in having the ACA and the support for the ACA that is about to expire? Do you believe in doing something about that?
In terms of the enhanced premium tax credits?
Yes.
The Democrats had two chances to make them permanent, and they didn't. And they didn't for a reason.
We're the ones who delivered it. So I'm just asking yes or no, do you want to do something about this? Yes.
I want to fix the system, and that's what we're doing, fixing systematically to make premiums lower. That's what President Trump wants to do.
Do you think the women on the steps of the Capitol were a hoax yesterday?
I don't know about any women on the steps of the Capitol.
The women who were talking about Epstein, do you think they were a hoax yesterday?
Do I think they were?
Do you think they were perpetrating a hoax yesterday?
Perpetuating a hoax?
Yeah.
I have no idea what they were saying. This is the first I'm hearing about it.
You're hearing about the women on the Capitol steps saying that they believe that the Epstein information should be made public? That's the first you're hearing about it? What I'm saying is you are perpetrating hoaxes. You, as the Secretary of Health. So you're undermining the whole healthcare delivery system, and you keep trying to point to chronic disease, but you're not putting solutions on the table to cover more Americans, and you're taking away the science and technology that has made us the leader that has saved, according to the first Trump administration Surgeon General, millions of lives, and you don't want to keep that going. So no, I don't support your continued efforts as Secretary, and I definitely think that our colleagues need to rally around science. If you want the Northwest to continue to lead on all innovation and all healthy people, okay, we'll do that. But it's a sad statement for the rest of America and America's leadership on technology. Thank you, Mr. Chairman.
Thank you, Senator Warner.
Mr. Secretary, I agree with a lot of my colleagues' statement. I actually had hoped, I didn't support you. I thought taking on chronic illnesses was going to be important. I've got two kids, as we discussed when you met, that have chronic illnesses. I'm not sure that the focus on red dye and seed oils are going to fully solve that problem.
Of course they won't.
I would say this, that seems where your emphasis is. I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of the CDC, and there was so many perverse incentives, and these are modeled studies.
You don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved lives?
That's the problem, is that they didn't have the data. The data by the Biden administration absolutely dismal.
So who is politicizing? You're saying the Biden administration politicized all the data? Go back to what Senator Cantwell just said.
Fired Dr.
Go to the Trump Surgeon General.
They fired Dr. Grubb. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Kaus.
So, Mr. Chairman, the Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you were sitting as Secretary of Health and Human Services? How can you be that ignorant? Like, you know, I remember when we went through the hearing with you, I asked you about community health centers. You didn't know what role they play. I've been visiting community health. I'm glad you've got to one. I think in April. I tell you what I hear on community health centers, they are terrified, with all due respect to my good friend the chairman, of the big awful bill, because they are going to lose health care across the board. They already live in food deserts. They can't get to a nutritionist because Medicaid doesn't do enough reimbursement. If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food? Absolutely. Well, then how is that going to happen with the Medicaid cuts that are taking place? There are no cuts to Medicaid. Sir, that is an absurd. There is not a single, some of my Republican colleagues, but there's not a single study that does not, I can tell you, I was in Franklin, Virginia a couple days ago. The rural hospital is going to close. The hospital system was so afraid they wouldn't even let me have the meeting there. But that rural hospital is going to close. And they are looking for where those folks are going to go. I mean, you're supposed to be doing health care policy, not being the doctor in residence for all of America. I hope I can just say, I'm still going to trust my doctor rather than your health advice.
That's the problem with our thing.
And obviously, Tom Cotton's going to, who knows who he's going to trust. But let me go back to policy for a couple, so maybe we'll lower the temperature a little bit. I got a bipartisan bill that would be a systemic fix, not a vote-buying mechanism when Medicaid's getting cut, what was put in on the rural hospitals. One of the things we could do, Mr. Secretary, is make sure that the folks who work in rural hospitals get an 80% reimbursement of what folks get in more urban centers. Would you support that legislation?
Are you talking about the area wage index?
I'm talking about the area wage index and moving that up to 80%, so there is actually ability to get rural providers.
President Trump supports that, and we support.
You support. Good. So you will work with us to get that passed.
Yes.
That will increase costs on both Medicaid and Medicare, so you are committed to that. I appreciate that. What about Senator Wyden and I've got a bill, because across America,
what about what?
Hospitals are shutting down on their OBGYN services. Try to have a baby. I don't know about all of my other friend states, but in Southside Virginia, you can't find a hospital. Will you work with us to make sure that before OBGYN services are taken out of a rural hospital, there has to be a process and procedure?
I'm happy to work with you on that, Senator, meet with you and see if we can work with you on it. I don't know exactly what the issue is.
Well, again, the Secretary of Health and Human Services, who has said he doesn't know how many people died from COVID, doesn't know if the vaccine saved lives, doesn't understand the issue that OBGYN doctors are fleeing rural America because they can't afford it. And with the cuts that are coming up, it's going to be exponentially worse. I would invite you, sir, to come with me to a community health center in Virginia and hear what is on people's mind. They want to get healthier? Absolutely. Count me in. But they also don't want their basic health care removed. Thank you, Mr. Chairman.
Senator Langford.
Mr. Chairman, thank you. Secretary, good to see you again. As I traveled around Oklahoma during August, it was great to be able to be home. I had several folks that contacted me, and we had some great meetings with some rural hospitals as well. They're looking forward to the $50 billion for the One Big Beautiful Bill that is targeting towards rural hospitals, starting with $10 billion next year. I know you're quickly getting all the instructions out on that. We know that's in process. It was good to be able to visit with them and be able to talk about that. They're very pleased. Thanks for the work you're doing on that. I also met with some of our groups that do incredible medical research on this. I know the NIH grants were held for a while and being studied. Those have been released, and grateful to be able to see that, because there's some amazing medical research happening, including some longitudinal studies, and they need those dollars released. So I appreciate y'all getting those released out there. I did hear from a lot of our folks, and I want to talk about one of these issues. From a lot of our hospitals, they immediately raised the issue of Medicare Advantage plans and how they're withholding payments, they're delaying payments back to hospitals, and a problem that's been for rural hospitals. I know y'all are working on that as well. We want to work with you on that. But you and I have spoken on the second issue on that, and it's the pharmacy benefit managers. During the confirmation process, it was interesting when you and I met in my office, you said every single senator brought up PBMs to you, and you made the statement during the confirmation process, this is an area that President Trump wants to take on, is the pharmacy benefit managers. This is unfinished business in this committee. But I wanted to just know, what is HHS doing at this point on the PBM issue in particular to make sure we're not driving out rural pharmacies, and what we can do to be able to make sure that's fair?
I mean, it's a priority for the president. He talks to me about it, I would say, at least once a week, sometimes at 11 o'clock at night. And we've met with the PBMs, and we are in talks with them. We're also in MFN talks with the pharmaceutical companies, who are also very interested in reducing the cut and getting transparency among the PBMs. And the PBMs have committed to us to transparency, to some protocol that will guarantee transparency. And then the part of the MFN negotiations would include direct-to-consumer marketing, which would eliminate the middleman. So I think we're doing a lot on PBMs.
Okay, that'd be very helpful to be able to see. It'd be very helpful for consumers across the country on this. You and I spoke as well, and you've made public statements on this, and the FDA commissioners made public statements on the issue of reviewing the safety issues of mifepristone. Your comments early on were every drug needs to be treated the same, needs to look at the same, and not have political biases and how things are actually examined. There were a lot of changes on the allocation of mifepristone for elective abortions under the Biden administration. It's now open to anyone without a prescription on it. You don't have to go through a doctor on it. There's all kinds of issues that are happening now on it. So the question was, you had said that there would be a review on that just to be able to look at it, make sure we're following all safety protocols. Do you know a timing on that review?
I can't give you the exact timing. I talked to Marty McCary about it yesterday, and he said it is progressing apace. We're getting data in all the time, new data that we're reviewing. And we know that during the Biden administration, they actually twisted the data to bury one of the safety signals with a very high safety signal, around 11%. So we're going to make sure that that doesn't happen anymore. We're producing honest science and gold standard science on that. I'll keep you abreast of where we are.
Thank you. Just go where the science leads on that. During the Biden administration, the Title X regulation that requires Title X family planning programs recipients to physically and financially separate from abortion activities, their Title X activities, and eliminate them promoting or providing abortion with those funds. That was flipped from the original Trump rule that was done on the first presidency. During a confirmation, you had committed to go back and look at that again and to be able to see. My question is, do you know the timeline for agency action for when that rule on Title X and the separation payments rule will be either reviewed or will actually be reinstated to the original Trump rule under his first presidency?
I don't know if they're I just don't know the answer to your question, why they're actually reviewing the rule right now. I can tell you that the NGOs that have that issue, that refuse to separate their payments streams and separate their operations, are not getting funded.
Okay, well, that was an issue under the law when it first came out, to be able to keep those things separate on it. So look forward to that. Thank you, Mr. Chairman.
Thank you. Senator Hassan.
Oh, thank you, Mr. Chairman, and good morning, Secretary Kennedy. Just before I ask a question, I did want to note, in response to the Secretary's statement that the Trump administration wants to lower the cost of health insurance, that across the country right now, the median increase from commercial insurers that we're seeing this fall is 18%, just as families are struggling to make ends meet. Now, I want to follow up on a line of questioning that Senator Cassidy began. Mr. Secretary, President Trump said that the COVID-19 vaccine produced by Operation Warp Speed was, and these are the president's words, a monumental national achievement. Although I have strongly opposed many of President Trump's actions, I agree with him that Operation Warp Speed in 2020 was a monumental achievement. Unfortunately, you are undermining one of the president's biggest achievements, which, as the president said, saved millions of American lives. You even went as far as to call President Trump weak for this life-saving accomplishment. Last year, you tweeted that President Trump has a weakness for swamp creatures, and that Operation Warp Speed was among, here's your quote again, the most devastating impact of President Trump's weakness. So, Mr. Secretary, was Operation Warp Speed a monumental national achievement, as President Trump said?
For the reason that I already said, and I assume you won't let me repeat, but I'm happy to if you want, yes, it was.
Good. assuming it is a monumental achievement, you've said it was, is it true that, as President Trump has said, he saved millions of American lives with the COVID-19 vaccine? Because you've just expressed great confusion about that to Senator Warner.
The only confusion I express is exactly how many lives were saved. I don't think anybody knows that because of the data chaos.
So multiple studies have shown that the vaccine reduced infections and severe diseases and saved at least 3 million lives in the United States and millions more abroad in the first 2 years of the pandemic.
As possible, those are modeling studies.
I will also note, just as you've been talking about data and concern about it, the process for COVID vaccine approval was public, it was live streamed, and it was out in the open. Manufacturers and experts have publicly submitted data analysis, and when the FDA has asked for more, they've submitted more. They've done that for years, and the evidence is clear and supports what President Trump has said. The vaccine works, and it has saved millions of lives. Your own process, on the other hand, has not been transparent. You repeatedly choose to ignore data because it doesn't match your preconceived notions and lies. So you have said that the vaccine did save lives. You've said it was a monumental achievement. And given that, if you agree with President Trump that the vaccine saved millions of lives, why have you acted behind closed doors to overrule scientists and limit the freedom of parents to choose the COVID vaccine for their children? Why have you done that?
For the COVID vaccine, I was removed by FDA because there was the industry.
No, it was behind closed doors.
No, it's not
and scientists who said they wanted to brief you on the science, scientists who wanted to understand why the FDA, why you unilaterally changed the parameters for giving vaccines, making it possible now, to Senator Cassidy's colleagues' points, that they're going to have to go off-label.
This is crazy talk. You're just making stuff up.
To prescribe a vaccine for children. I'm not making things up. Do you know how the FDA approval process works and what?
Yeah, I do. I know exactly.
Do you know what an off-label prescription is?
I know exactly how it works. I know exactly how it works.
So why behind closed doors?
It's not behind closed doors. The industry makes the studies, and they could not provide a study that said that it is effective for healthy kids.
So when have you produced the data that you relied on and that this FDA relied on to change those parameters? You did it behind closed doors.
No, the data is all public.
Now parents who decide that they do want their children to have
You're just making stuff up, Senator.
I'm not
You're just making stuff up.
You know, sometimes when you make an accusation, it's kind of a confession, Mr. Kennedy. So let's just settle with this. So here's what's going to happen. To Senator Warner's point, to the parents who are concerned all around the country, to people who want to get the COVID vaccine this fall, even if they're under 65, because the boosters have worked, there's been much less serious disease, people do not have the same level of threat and risk from COVID that they used to because of these vaccines. People who want to exercise their freedom of choice are being denied that because you are citing data that you won't produce to the public.
You're just
you are rejecting
You're
science.
making things up to scare people, and it's a lie.
With respect, I do not think I'm the one making things up.
You are lying right now, Senator.
Senator Barrasso.
Thanks, Mr. Chairman. Mr. Secretary, thanks for being with us today. I believe one of President Trump's greatest achievements was his bold and successful actions on COVID. When faced with a global pandemic, he didn't back down. He was determined to find a cure, and through Operation Warp Speed, a vaccine was developed that distributed quickly, safely, effectively, and I believe it saved many, many lives. I think it's a model of American ingenuity and public-private partnership. But this wasn't the first time an American president acted boldly to address disease and vaccines. There's a great book that's out. It's a prize-winning book called The Fate of the Day by Rick Atkinson, and he talks about the courageous efforts by George Washington. During the Revolutionary War, George Washington reversed his opposition to the smallpox vaccine, and he ordered that all the soldiers be vaccinated. It was among the most consequential decisions Washington would ever make. By protecting his troops from smallpox, Washington preserved the Continental Army, which allowed our nation to continue to fight for our independence. And like President Trump, I believe President Washington acted decisively to protect Americans' lives at a time of great national peril. So over the last 50 years, vaccines are estimated to have saved 154 million lives worldwide. I support vaccines. I'm a doctor. Vaccines work. Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned. The public has seen measles outbreaks, leadership of the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on. You know, recent polls said 89% of voters, 81% of Trump voters agree vaccine recommendations should come from trained physicians, scientists, public health experts. So, you know, they believe, you know, Senator Marshall, Senator Cassidy, they believe me when it comes to vaccines. If we're going to make America healthy again, we can't allow public health to be undermined. So could you explain what steps you're going to be taking to ensure vaccine guidance is clear, evidence-based, and trustworthy?
Yeah, we're going to make it clear, evidence-based, and trustworthy for the first time in history. For most, right now, you know, when I was a kid, I got 3 vaccines, I was fully compliant. Today's children have to get between 69 and 92 vaccines in order to be fully compliant, between maternity and 18 years. Only one of those 19 vaccines, 92 doses, only one of those vaccines has ever been tested against an inert placebo. And what we're doing now is any new vaccine that before it's approved and licensed will have to demonstrate safety against an inert placebo. And we're going to go back and do observational studies on the existing vaccines to see if they're linked to any of these chronic disease epidemics so that people can understand the risk profile of those products and make good assessments for their own health.
So in 2 weeks, vaccine experts at the CDC are going to meet to discuss childhood vaccine recommendations. Parents and physicians depend upon this guidance to make decisions and to keep kids safe. And as I said, I support vaccines. I've been hearing from many of my medical colleagues, people I've known from medical school, residency, and when I practiced medicine in Wyoming, and there are real concerns that safe, proven vaccines like measles, like hepatitis B, and others could be in jeopardy. And that would put Americans at risk and reverse decades of progress. As we've seen over the last 4 years, the previous administration 4 years, when recommendations became politicized or were swayed by bias, and the public trust can be lost. So what safeguards are in place to ensure decisions are based solely on science and not politics? And how are you going to make sure doctors and parents can count on CDC guidance?
I mean, Senator, I would point this out. Right now, there's only 10% of children are complying with the CDC's recommendation on COVID boosters. Only 15% of healthcare workers. So Americans have lost faith in CDC, and we need to restore that faith. And we're going to do that by telling the truth and not through propaganda, by making them understand that everything that we say is true, that we're going to tell them what we know, we're going to tell them what we don't know, and we're going to tell them what we're researching and how we're doing it, and we're going to be transparent. It's the only way to restore trust in the agency, by making it trustworthy.
Finally, with chronic diseases like you, I'm committed to addressing our nation's growing rate of chronic diseases. I think if we're going to make America healthy again, we need to support rural primary care providers that play a role. As a rural physician, I want to make sure we can prevent and manage chronic diseases in their communities, and I ask for you to continue to work with us specifically with regard to rural health.
Thank you, Congressman.
Senator Daines.
Chairman Crapo, thank you. Secretary Kennedy, welcome. It's good to see you here again. I want to begin my time by talking about the issue of federal deregulation of chemical abortion drugs. Since mifepristone was approved in 2000, 25 years ago, the FDA has steadily stripped away safeguards related to this drug, no longer requiring a doctor's prescription, no follow-up visits, no adverse event reporting, and now allowing it to be sent through the mail. Earlier this year, there was a new study that analyzed 865,000 real-world insurance claims, and it found that nearly 11% of women experienced a serious adverse event within 45 days of taking mifepristone. To put that in perspective, that is 22 times higher than the FDA's long-standing estimate of less than 0.5%. While these findings alone are shocking, my conversations with those in the medical profession, credible medical professionals, lead me to believe that even this study may indeed underrepresent the scale of the problem. For years, we've heard the misleading and frankly very harmful lie that's being sold to women that this drug is, and I quote, safe as Tylenol. These lies sadly have real-world consequences. Just last year, 2 women died as a result of taking chemical abortion pills because they were able to access them without appropriate medical oversight. And by the way, that's all allowed by the FDA. Mr. Secretary, I am grateful that you and FDA Commissioner McCary have already begun the process of reviewing this new data on the safety of mifepristone. We talked about this during your confirmation hearing. My question is, could you provide any update on the status and the scope of that review and whether the FDA intends to replicate studies like the one that I referenced?
I think those are, I don't know if they're going to do an insurance claim study. That's one way to do it. I don't know exactly whether they're doing epidemiological studies or observational studies. I don't know exactly what they're doing, but I know I talked to Marty McCary about it yesterday, and he said those studies are progressing and that they're ongoing. So I will keep your office informed at every stage.
Thank you. And I've had a really constructive conversation with the FDA Commissioner as well, McCary. And I mean, here's a very smart, data-focused, sincere type of leader. And we had a really good conversation. I want to encourage those conversations with you, Mr. Secretary, and that there's a follow-up here to make sure that the data that we now have exposed will be studied by the FDA and the appropriate actions considered. Given the legitimate safety concerns surrounding mifepristone and your actions to roll back other COVID emergency measures, will you repeal the COVID-era telemedicine allowance, given that we're repealing these COVID-era regulations and emergency measures? Would you repeal the COVID-era telemedicine allowance for chemical abortion drugs and restore the requirement for an in-person doctor visit?
Senator, I need to get back to you on that. I don't know if the White House has yet taken a position on that. We will get back to you this week about that.
Okay, all right. Thank you. I want to close with a quick Montana question. Earlier this week, the state of Montana submitted a Medicaid demonstration waiver application to CMS to strengthen the state's Medicaid expansion program. This waiver seeks to require community engagement and enhance cost sharing for working-age, able-bodied adults enrolled in the program. I applaud our governor, Gianforte, and Director Brereton for their proactive leadership in this space. My question is, Mr. Secretary, could you commit that CMS will work quickly in its consideration of Montana's waiver application?
Absolutely. It sounds like the kind of waiver that we're looking for.
Okay, thank you, Mr. Secretary.
Thank you, Senator Johnson.
Thank you, Mr. Chairman. Secretary Kennedy, first of all, thank you for your willingness to serve and for putting up with this abuse. 5 minutes is even close to refute all the falsehoods that have been confidently spewed during this hearing. We'll talk about real data here, okay? Well, first of all, thank you for breaking the logjam of information of HHS. My committee's got now over 8 million pages of information. Just in the first tranche, by the way, what we discovered is that the CDC, somebody in the federal health agencies, this interagency communication, hid the signal. They admitted there was a signal on myocarditis, and they hid it. They didn't warn the public. They didn't warn doctors. So that's just one instance of corruption and lies told by the CDC. We've got a lot of others we'll be rolling out, okay? So we held our first hearing in permanent subcommittee investigation on that hiding of the signal myocarditis. We've heard a lot of studies, okay? As I've looked into science, it's been thoroughly corrupted. Here's data, and I'd like to enter this sheet into the record. I've been publishing this chart for, since really early 2021, when I'm on, for example, talk radio shows and they talk about this, they get deplatformed, or they were, because all the censorship in the Biden administration. Here's the facts. The VEUTERS system that was touted in October of 2020, this great safety surveillance system on COVID, a few months later, when they didn't like the results, they started denigrating their own system. But VEUTERS shows that there have been 38,742 deaths reported on VEUTERS worldwide associated with the COVID vaccine. 38,742. 9,252 of those deaths occurred on the day of vaccination within 1 or 2 days. Again, I agree with you. Nobody knows how many COVID deaths were because the information was completely corrupted. Nobody knows how many lives were saved by the COVID. Again, I think most people, okay, if you're vulnerable, raise your antibodies, reverse severity, fine. There's not any good study on that. There's just information out there, just claims being made. This is hard evidence. And certainly what I've been advocating for are the injection injured, the childhood vaccine injured. We're going to be holding a hearing next Tuesday on a study done by a high-integrity healthcare facility that shows, that actually looked at vaccinated versus unvaccinated, very high-quality study. I'm not going to steal the thunder of Aaron Secy, who's going to be testifying on this. I think you're aware of this study that shows the vaccinated population far more prone to chronic illness than people completely unexposed to vaccines. That is just one example of how science has been corrupted by the way, the study was conducted, and when they conducted it, oh no matter what the results are, we're going to release this. They got the results in 2000. It is yet to be released. We're going to enter that in the record on Tuesday. Do you want to just talk about what you've witnessed in terms of the capture of the agencies that you're now in charge of, the corruption of science, which I believe you just said, that is almost your number one goal, right, is try to bring integrity and credibility back to science, which has been corrupted by the people who pay for it, by federal health agencies being captured by pharmaceutical industries, by big pharma, by big food. I want to give you, I'm sorry, just the last minute to, first of all, defend yourself, but talk about the corruption of science that you're having to deal with and trying to correct.
Yeah, I mean, I'll just tell you one example, and I could sit here and give you thousands. But in 2002, CDC did an internal study of Atlanta, Fulton County, Georgia children, and looked at children who got the MMR vaccine on time and compared those to kids who got them later. So in other words, kids who got them before 36 months and kids who got them afterward. The data from that study showed that black boys who got the vaccine on time had a 260% greater chance of getting an autism diagnosis than children who waited. The chief scientist on that, Dr. William Thompson, the senior vaccine safety scientist at CDC, was ordered to come into a room with 4 other co-authors by his boss, Frank DiStefano, who's the head of the immunization safety branch, and ordered to destroy that data. And then they published it without that fact. So you know that story, I know that story, and you know of hundreds of stories like that. It happens all the time. We are being lied to by these agencies, and we're going to change that right now.
The letter I received from the Oshkosh business, it would be out of business because of the 50 employee mandate. It's going to be out of business. I just want to enter that in the record as well.
Without objection. The committee will take a 5-minute quick break here just to allow just a moment of reset here, and then we'll start right back up again in about 5 minutes.